Welcome to today's theory video on the certificate in PRP and phlebotomy, and we're going to talk about everything that you need to know on how to actually carry out a PRP facial treatment and PRP for hair loss. So we have actually split the learning material in 3 different sections. As you can see, we're going to go through phlebotomy, PRP on the face, and then PRP for the hair as well. So let's start off with the phlebotomy. Now, as you can see, we're going first into the circulatory system, and here you have 3 major components. You have the arteries, the veins, and then the capillaries as well. So what are we concerned about is the arteries and the veins and what the actual function it is of them. So any blood vessel, the overall function of them is to actually carry the blood. And why is that important, and why do you need to carry the blood? Is the blood has all the oxygen and all the nutrients. So the arteries and the veins are the one that carry the blood to and from the heart. So as you can see, the arteries actually carry oxygenated blood from the heart to the rest of the body, and then the veins do exactly the opposite. They collect and carry the deoxygenated blood all the way back to the heart. And then you have capillaries. Now, capillaries are the very small, delicate blood vessels which then just transport all the nutrients and all the oxygen from the blood to the rest of your cells and the organs throughout the body. So that is how your circulatory system works, and the main things are the arteries, the veins, and then the capillaries. Now, when it comes to phlebotomy, we have to look closely into the veins, especially on the arm, as that's where you'll be actually drawing blood from. Now, you have 3 major veins here. You have the median, cephalic, and the basilic. Now, the median is the one that's right in the middle, and whenever you're carrying out phlebotomy, this is the first choice of vein that you actually want to get. This is the main one. This one usually is very easy to pick, very easy to go into, and that should be the first choice when it comes to actually carrying out the phlebotomy. Then you have the cephalic one. Now, this is the outer kind of vein. This is the second choice when it comes to carrying out phlebotomy. And then the one that is quite close to the body, that is the basilic one. This one tends to be quite prone to actually getting a little bit of bruising, so that should be your last choice of vein, really, as your first one should most of the time be the median, as that is quite easy to find, quite easy to draw blood from, and also not that likely to cause any bruising. Now, when it comes to the actual injection technique and how phlebotomy works, as you can see, depending on the position as to how you place your needle in your syringe and the angle is really dependent on what layer of the skin you're actually going to enter. Now, let's say you have the 90 degree, that would be the intramuscular. So if on 90 degree, you are going straight deep into all the skin layers and you're going all the way down to the muscle. Then you have a 45, that would take you to the subcutaneous layer. And then on a 25 is the one that we're actually looking for. That is the intravenous one. So a 25 degree is what will actually take you to the vein. And then if you're going lower than that, if you're at a 15 degree, so that's really, really superficial. That's an intradermal kind of angle that you're doing with your needle, so that would take you to the dermal areas of the skin. So make sure you're at a 25 degree, not higher than that, not lower than that, as you don't want to be too deep and you don't want to be too superficial in order to get to the vein. And when it comes to the actual technique of the phlebotomy, so as we said, you do want your needle to be on about 25 degree to actually get into the vein. Now, as you can see on the left, we already have our needle at about, let's say, a 35 degree angle, and we're penetrating through the skin, going as to where the vein is. However, we're not changing the angle of the needle. So what happens is that we actually end up going straight through the blood vessel. And in order for you to be able to draw any blood, you have to be right where the vessel is, in the middle of the actual vein. And as you can see on the next picture, we are inserting the needle at an angle and then slowly flattening it in order to actually get into the blood vessel and be able to draw blood. Now, that is the actual correct angle as to what you'll be aiming to do in order for you to successfully draw blood from the vein. So just make sure you avoid sticking to the exact same angle. Put it at about a 25 degree, flatten your needle, and then you can successfully enter the blood vessel and draw blood. Now there's something called flashback as well. Now you can see on the left hand side there's flashback, and that indicates that you have then successfully entered the vein. Now on the right you see that the needle, there is no flashback. And how can you tell? You can see on the yellow part of the needle there is already blood coming through, and on the right side there is no blood coming through the needle. Now if you don't see any flashbacks as soon as you push your needle in, that means that you have not successfully entered the vein. So you will either be too superficial, you've went in too deep. In that order, what you can do is you can either adjust your needle slightly, so make sure you come out a little bit, or you put the needle a little bit deeper if you were too superficial, or completely take the needle out and then retry taking blood from a different vein. So very careful when it comes to flashbacks. You can only actually draw blood when you see that there is a flashback running through the needle, and if you don't see any, just try to take the blood from a different vein. Now, what do you need from phlebotomy? You're going to need a blood tube. This is a Vacutainer sodium citrate tube. You do need the sodium citrate as it's a coagulant of the blood. So whenever you actually get this tube, this one is specifically for just extracting plasma from the blood. So the tube has to be a 3.2 sodium citrate, and then a 9 ml tube. We do recommend the 9 ml as they tend to be a little bit larger, so you can get a bit more plasma extracted from that. And the 3.2 sodium citrate, what does that do is when you use the sodium citrate in combination with the whole blood, and when you spin it through the centrifuge, the sodium citrate just stops the blood from coagulating, and that makes it separate into 3 different components, as you can see. So whenever you are actually doing that phlebotomy, make sure that you have the blood tube at a 3.2 sodium citrate. And then the phlebotomy needles that you're going to use. Now there's 3 different types, which are the most popular ones that you can use, but there is other different ones. There's larger and smaller ones. So you can see the first one, this is the green one, so that's at a 21 gauge. So this one is relatively quite thick, and the blood can flow through very easily, so that's one of the most popular ones. Then you have a 22nd gauge. The 22 gauge is a lot more thinner than the 21 gauge, and this one is used for smaller veins that are, fragile. Just be mindful with the 22 gauge that the blood would come out a lot more slower, as the needle is actually thinner in comparison to 21. Then you have 23. 23 is a really thin kind of needle. It's great for smaller veins or fragile veins, if you're trying to get any vein from the hand as well, or just anyone that's a little bit scared of having their blood taken, as the 23 is so thin that you can even barely feel the needle going in. But also, yes, mind the fact that it's a very thin needle, so the blood actually comes out quite slowly with this one, but whenever you're using it, it's not painful at all. When it comes to the needles overall, we do recommend using the butterfly needle, as it's very easy to actually handle. So there's other types, however this one tends to be the most popular within clients as well, as it doesn't actually cause them any discomfort whenever you actually put the needle in. So that is the butterfly needle. Then you're going to need a phlebotomy tourniquet. Now the tourniquet, actually you have to apply maybe about 3 to 4 inches away from the injection site, as you can see on the picture here. And the reason why you are actually having to put the tourniquet on for you to actually draw blood is that the tourniquet constricts the blood flow of the blood in the arm, and that makes the veins a lot more prominent and a lot more easier for you to actually being able to find where they are and be able to draw blood from that. Just keep in mind that whenever you put the tourniquet on and you start drawing blood, you should not leave it on for longer than a minute, really. So usually after the first blood tube that you do fill out, you will have to remove the tourniquet and then carry on drawing blood. But just make sure that you do avoid leaving it on for more than a minute, as it can actually cause hemoconcentration. Then there's different factors that can affect you drawing blood. So one of the most common ones, that is age. So with age, it could be a little bit trickier to get blood. The veins are more fragile. Even if you do actually enter the vein, sometimes the blood would just not come out. So age is one of those factors. You also have medical conditions. You have medications that the client might be taking that could also be affecting the size of the veins, the blood flow from the veins, and it could make it a little bit more difficult for you to get the blood out. Also emotions, you will find that people that are very stressed, very anxious, and it's a little bit more difficult to draw blood. And also fasting. So anyone that hasn't, eaten well, anyone that hasn't had, an average amount of water, and water is a big thing here for phlebotomy. You will see that clients that have not been able to stay hydrated throughout the day, or on average are not really hydrated. It's a bit of a struggle to actually draw blood from the vein, because they have not been, they haven't really stayed hydrated. And fasting is one of these things. It's really difficult to draw blood from anyone that has been fasting for some time. So whenever you're doing phlebotomy, always consider all of those factors, because sometimes it's not even about whether you have successfully managed to find the vein and go inside. It might as well be that your client hasn't had enough water, or they're feeling really stressed and really anxious. So always keep that in mind. Now, when it comes to the protocol, what are the steps of actually carrying out the phlebotomy? The first thing you want to do is palpate the vein. So you want to have a look, feel the vein, and then decide which is the best vein to pick and which is the best arm to actually go for. Then you're going to put the tourniquet on, which would make the veins a lot more prominent, a lot more easier for you to actually find. Then you're going to need to sterilize the injection site, and you're going to use the rubbing alcohol for this. Just wipe once, make sure it's sterile, and then insert your butterfly needle in one of the veins that you have chosen. Once the needle is in, and then you see the flashback coming through, and it's showing you that you have gone into the vein, then you can just pop on the blood tube into the vacutainer of the butterfly needle, and then it would just stop. It would just start pushing the blood inside of the blood tube, as the vacutainer provides that vacuum. And once the blood tube is actually full, you can take it out of the vacutainer, very gently turn it side to side twice, so you can mix the blood together with the sodium citrate. And once that is done, just place it to the side and insert the second blood tube. Now, probably at this stage is where you would want to remove the tourniquet, because again, you don't want to leave it on for longer than a minute, as that would actually increase the hemo concentration. So slowly just remove the tourniquet, and then you're still leaving your needle in, and you're still filling in the second blood tube. So as long as the blood tube is full, just take it out gently, turn it side to side twice, and then just leave it on the side. To remove the needle, you're going to pop on a cotton pad on top of the tip of the needle, put some pressure on, and then gently draw the needle out. And when there's no bleeding, just pop on a plaster on top of the injection site. And that's your main protocol for carrying out phlebotomy. Now, precautions and what to actually be careful of whenever you're carrying out phlebotomy is, first off, an arm on the side of mastectomy. So no matter when the operation was actually done, it's a big no-no to be doing it on the same arm. You can still do the phlebotomy, but it's safer off to actually pick the other arm and try a vein from that side. Also, you can't do it via an open wound or an affected area, especially if it's right next to the injection site. Just take it from the other arm if that's the case. And you can't take on the arm which has had blood transfusion, and you can't do it on an arm with an existing or pre-existing blood clot. So you would need to really ask your client about their medical history and anything indicating that they could potentially have any contraindications to phlebotomy. And you're also quite careful of hematoma. So if the client has already had a blood test in the past couple of days and they have a really, really big, nasty bruise on that arm, you will probably just want to get the other arm, or if that's the case, on the other arm as well. See if you can get another vein that is not where they already have the bruise of, or if there's no other option, just tell them to come back whenever the bruise is healed, probably about 7 to 10 days on usually. And then also scarred or burned areas. So that is a little bit tricky, especially if it's on the injection site as to where you're trying to get the blood from, as the scar tissue can be quite hard to penetrate through. So just make sure you are quite cautious of areas like this. And then complications of what could happen from phlebotomy. So obviously one of the main ones that you can see is bruise. Again, quite normal. If with any kind of injectables or any kind of treatment involving needles, it's a possibility. If a bruise does happen, the client can apply arnica and that will help them heal quickly. But after 7 to 10 days, the bruise will slowly go away and disappear. Now the other thing that you could possibly see is a hematoma. So a hematoma is more of a heavy type of bleeding. Hematoma happens where you have completely pierced through the blood vessel when you've come out, and there's so much blood that has actually come out from that blood vessel that it has pulled all around the injection site, creating a little hematoma. And what you will find with the hematomas is that they heal a lot more slower and they're a lot more darker in color. But basically what a hematoma is, it's just a very severe type of bruising. So you can see it's a lot darker in color, so it's almost black to purple kind of color. Again, it's a possibility. However, if your injection technique is quite gentle and you're using about a 25 degree angle, you should not really be experiencing any severe bruising like hematoma. And then the other thing that could happen is a possible infection. Now this is done if there is already an existing infection on the injection site, or if you have not sterilized properly, or if the client has really touched the area with dirty hands quite a bit after you've done the phlebotomy. Very rarely seen, however, still it is a possibility. So you always need to make sure that you're really sterile and you're always sterilizing the area in order to avoid infection. And then the other thing you have to be pretty cautious of when it comes to phlebotomy is people just feeling really faint. And this is when you really need to know the first aid protocol and how to actually recognize if anyone is going to faint, or how to deal with it and what to do in that case, as that is quite common with phlebotomy sometimes. So if anyone is feeling, they get a bit overwhelmed, sometimes people are simply scared of getting their blood drawn, so that could possibly cause a fainting episode. But if that does happen, the first thing that you want to do is to help the person actually lie down. So the main objective here is to raise their legs up. Now the main reason why anyone actually faints or feels really lightheaded and is about to faint is because the blood from their head just rushes down and the blood pressure really drops down. And that could lead to possible fainting. And why do you want to raise their legs up? As you can see on the picture, is by raising their legs up, you are pushing the blood back into the head and you're going to bring the blood pressure back up, and they're going to come around quite quickly this way. In case the person actually falls down while they're fainting, just make sure that you're not really moving them. Make sure that they don't have any injuries. Just check if they're okay. And once they've actually come, conscious, and you can see they're coming around, just give them a little bit of sugar. You can give them chocolate cookies, simple sugar. You can give them sugar that has been dissolved in a little bit of water. Just make sure, if they are unconscious, do not give them water or sugar. Just only give them water and sugar as soon as they come back around and they have recovered. But for the time being, just keep their legs up, and the sugar will just help them bring the blood sugar levels back up, so it will help them come around very quickly. So that is the main protocol when it comes to possible fainting. Now that's on phlebotomy, and now moving on to the PRP facial, or the also called vampire facial. Now you have done the phlebotomy, you have taken the blood tubes. Now how do you actually get the plasma to work with? Now what you want to do is take the 2 blood tubes that you have taken from the client, and you're going to put them on opposite directions of each other into the centrifuge. And the centrifuge would actually help you spin that blood tube really quickly, and the actual centrifuge will cause the different compartments of the blood to actually separate through the actual speed that you run them through. How to set your centrifuge up is speed-wise, you're going to do about 3,780. Make sure that the speed on the centrifuge is no more than 4,000. And when it comes to the actual time, you're going to put it on about 8 minutes in order to get your plasma. Now, after the centrifuge is finished, you're going to really gently get the blood tubes out of the centrifuge, and what you will see is that the whole blood would have separated into 3 different components. Now you have a 41% of the red blood cells. Now again, these ones we're not using, and then you have the 4% of the white blood cells. We're not touching the white blood cells. We're only going to use the plasma for this treatment, and you should get about a 55% of the plasma. So again, 3 different components, but the only one you're actually going to use during the treatment is the plasma itself. Now, hemoconcentration and what it is and how it can actually happen and how to prevent it. Now, as you can see on the left, when it comes to the actual amount of red blood cells, white blood cells, and the plasma is to what you would normally get after the centrifuge. As you would see, the red blood cells, it could be in between 30 to 40%. If anyone is anemic, for example, you would see that the red blood cells would be a lot more less, as anemia actually affects the production of the red blood cells. But then in comparison, on the right hand side, you have an example of hemoconcentration. Now, hemoconcentration is when you have a larger amount of the red blood cells and then you have very little amount of plasma. How does that happen is if you leave the tourniquet on for a prolonged period of time, that can actually cause a hemoconcentration after you actually put the blood tube through the centrifuge. You might find that most of the time the red blood cells are quite a lot in comparison to the plasma. Then how to avoid that? You simply, you just need to remove the tourniquet after a minute and don't leave it on for longer, just so you can get the most amount of plasma from the whole blood as you can get. Now, what is plasma and what is it so great and what does it do? Now, plasma has a lot of different growth factors. As you can see, it has a platelet-derived growth factor, which helps with regeneration and repair of the blood vessels, helps with growing of new cells, and also repairs any damaged cells along the way, and helps with the production of collagen, elastin. So really amazing when it comes to regenerating and repairing the skin. Then you have the vascular endothelial growth factor. So this has got to do with all of your blood vessels. So it recovers any damage that has been caused over time and helps regenerate new blood vessels as well. Then you have the transforming growth factor. So this one again helps you to promote the healing of the skin, has a regenerative and very repairing function to the blood vessels. It can produce the collagen and the elastin, and very essential when it comes to the neogenesis of the epithelial cells. Then you have the epithelial growth factor, and again, pretty similar to the transforming growth factor. So it's got to do with producing new epithelial cells, angiogenesis, and the promotion of the wound healing, which is very essential for the main structure of the actual skin. And then you have the fibroblast growth factor. So this is the one that actually stimulates the production of fibroblasts, the production of collagen, elastin, hyaluronic acid, as well as just triggering the production of new cells. So why is plasma so amazing when it comes to skin? Is because of the fact that it contains so many different growth factors. It has the ability to work on the skin's repair, regeneration on a very cellular level. So really essential and really amazing when it comes to completely restoring and repairing just the whole layer of the skin, both the dermal as well as the epidermal layer as well, because it works on the dermis in terms of the collagen, the elastin, and the blood vessels, but then also by producing completely new, healthy, new skin cells in the epidermal layer. So you can target the skin from anywhere whenever you're using the plasma. Now, skin anatomy and when it comes to skin aging and looking more closely into the skin layers and how aging actually has an effect specifically on the dermal layer. So as you can see on the left, you have the younger skin where you have really strong collagen and elastin, which are binding together with the epidermis and the subcutaneous, and that gives the skin that elasticity, that firmness, the plumpness, and this is because the bonds of the collagen and elastin are really strong. And then you also have the intact fibroblasts, and fibroblasts are actually responsible for the production of collagen and elastin, so they really go hand in hand here together. And then you have on the older skin, this is where there's a lot less fibroblasts that you can see, and they have actually expanded in size, and their production is quite reduced. So means that on their own, the fibroblasts they just can't really produce as much collagen and elastin. They can't trigger it as much as they did before, which then results in a lot less collagen and elastin down the line. As you know, with the aging process, you start losing a lot of the collagen and elastin protein. So as you can see, really important that the fibroblasts levels are actually maintained at the same time with the collagen and elastin, as they go actually hand in hand. Now, as we mentioned, the benefits of PRP, and we also did mention the growth factors and what it does. And as we already discussed, it can target the skin from the dermal layer to the epidermal layer, and you can even see here it stimulates the collagen production, and it also stimulates the fibroblasts, which is amazing because the more fibroblasts you have naturally, then the more collagen elastin you will produce over time. And also works on a cellular level. So as we said, it can repair damaged cells, it can improve the production of new healthy skin cells, so it can trigger the production of new cells. Also induces the cell turnover, so that would also produce new skin cells and make your epidermis a lot more stronger than it was before. Repairs the damaged skin cells and then promotes healing. And again, it can completely regenerate and repair the whole dermal and epidermal layer as well. Now, the vampire facial, and what does it include? Now, as you can see here, we have the microneedling with the plasma in combination. So what does the microneedling actually do? The microneedling will allow you to open up microchannels into the skin. So that is great for actually delivering product into the deeper layers of the skin. But also the actual micro needles by themselves, they can cause a controlled injury. And as you know, the controlled injury to the skin would actually trigger the healing process as well. So really amazing when microneedling is used together with the plasma. As we mentioned, plasma is so great for everything really, and being delivered both into the epidermis and the dermis, and it can work really wonders. So what the main objective with the microneedling with the plasma is to open up those microchannels and push the plasma into the deeper layers of the skin and let it do its job. And then the microneedling is also great because it would only boost the results that we are already delivering with the plasma on its own. And as we mentioned, the skin healing process and causing injury with the actual dermapen and carrying out the microneedling. Here you can see the 4 stages of the skin healing. First off, you have the hemostasis. So this is the first initial stage as to where the skin, you have caused injury to the skin, and the first response is to get the blood to start clotting. So for example, you've cut yourself, give it a couple of seconds, and you're going to stop bleeding. So that's the blood clotting in order to, stop you from bleeding any furthermore. So that is the first stage, and then the second stage is the inflammation. So this is when you get all of your white blood cells and macrophages coming up to the actual injury, and what it actually does, it starts clearing out the injured site from any potential bacteria. So this is the inflammation stage. This is where you experience that pain, that redness, that swelling, and this is all due to the fact of the white blood cells coming up to the injured site to actually clear it out of any bacteria. Then you have the proliferation. So this is where you normally see where you cut, has kind of got like a scab on top. This is during the process when you have actually started to produce new skin cells, and it's not inflamed anymore. It's not red and really painful, but it's not ready to get the scab off completely. And then you have the final stage, which is maturation. Now this is when you have completely produced new skin cells. You have produced new collagen and new elastin, and you have got rid of the initial injury, and that has been replaced by new cells and by new collagen and elastin. So what we were trying to achieve with the microneedling by causing injury is to actually trigger this specific skin healing process, which would then, the end result of will be to produce new cells and new collagen and elastin. Now to move on to the PRP injections. Now PRP injections are great because by injecting, it allows you to go into a very specific layer of the skin and also inject a really large amount of the plasma, which you can't do at a specific site if you're using the dermapen. Now with the plasma, again, when it's delivered to the epidermal or the dermal layer, it has the amazing ability to produce new cells and stimulate the collagen elastin, and also hyaluronic acid, and stimulate the fibroblasts as well. So injections are great because you can inject a lot more of the plasma into a very specific area that you're trying to target. Now when it comes to techniques, you have two main techniques that you can use with your PRP injections. You have the bolus technique. Now this is where you insert the needle and you stay in one place and you inject a bolus, large amount of product into one place. And as you can see, the needle is not moving anywhere, and you're injecting basically like a ball of product in one place. And then you have the linear technique. This is where you insert the needle all the way through, and then you place your product as you're coming out with the needle, creating a line of product. So both of those techniques you can use depending on what area you're trying to treat, depending on what you're trying to achieve as well. So any technique would really do. Now, what concerns can you actually treat with a PRP treatment? The very popular ones when it comes to clients, you have the PRP for pigment concerns. So that would be hyperpigmentation, sun damage, melasma, and even skin tone, anything that's got to do with pigment. Now, for this one, you can carry the needling and the injections both at the same time. When you do the microneedling with the PRP, you want to combine about 4 ml of the plasma with 1 ml of the medical grade vitamin C. You want to add vitamin C to boost the actual properties of the plasma, and the vitamin C is really brightening, so it works really amazing on anyone with a darker skin tone or anyone with pigmentation concern really. And for the needling, you will want to use a 36 pin needle, and you're going to do about a 1 millimeter depth. Be quite careful with the microneedling. Do not overwork the area, as you have to be quite cautious with the darker skin types, as you can cause more damage if you do actually overwork the area. And then when it comes to the injections, you combine a 4 ml plasma with 1 ml Pink Glow, as Pink Glow contains glutathione, it contains vitamin C, hyaluronic acid, minerals, amino acids. So it's a really great cocktail of really skin feeding nutrients that you can combine together with the plasma. And Pink Glow, it's really, really brightening. And once combined with the plasma, you can just use a 4 mm needle to inject it all over the areas that are, in concern with the client. And also in terms of the treatment frequency, you would want to do this about every 4 weeks, and you do need to let your client know that they would probably need a session of 3 to 4 treatments. They will see a result from the first treatment. However, they do need to know that it's a course of session in order for them to achieve the best results possible. Then you have the PRP for aging, and in this case, again, you're going to combine 4 ml of the plasma and then 1 ml of the medical grade vitamin C, and this is to specifically target the sun damage, which is very commonly seen in anyone with aging concerns as well. Then you're using the same pin needle. You want to need about a 36 pin needle, and you're going to use a 1.2 mm needle depth. Now you're going to increase your needle depth because you actually want to be delivering the plasma in the dermal layer and also causing injury to the dermal layer. And this is to stimulate fibroblasts, collagen, and elastin as well. And then the PRP injections. Now for aging, you're actually going to mix the plasma together with a 1 ml to 2 ml hyaluron skin booster. Now the skin booster will actually improve the hydration levels and boost the levels of the hyaluronic acid into the dermis. And with that one, you're going to use a 4 mm needle and inject all across the face or on specific areas of concern intradermally. So you definitely want to be injecting into the dermis. And then again, the treatment frequency for this one as well, every 4 weeks. And again, it's usually on average a course of 3 sessions. And then PRP for acne or acne scarring, any type of concern that's got to do with acne or breakouts or any scarring that is left from that, you would still want to do the needling as well as the injections. And for the needling, it's pretty much the same with 4 ml plasma and 1 ml medical grade vitamin C. But in this case, you are going to go a little bit deeper on a 1.5. Judge this by the client's skin. So if the client's skin is not that thick, you will probably want to go about 1.2. But if the scarring is deep pitted, if the skin is quite thick, you can do on about 1.5 millimeter depth. As to actually really get rid of the acne scarring by themselves, you do need to be quite deep into the dermis, especially if the scars are deep pitted as it is, as you need to really cause quite a bit of injury. And then the PRP injections, just use a 5 ml plasma and inject all over the face. And again, you can judge this by the client. If their skin is quite dehydrated, you can also mix that with a bit of skin booster, or if they have an uneven skin tone, you can also mix that with some pink glow. So entirely dependent on what you actually see with your clients. Now PRP side effects and what you might see. So the first one is track marks. So track marks you can probably see most of the time if you have used the pen incorrectly. So instead of doing circular movement or stamping movements, you have actually dragged the pen across. So that's when you can leave track marks with the little micro needles from the Dermapen. And then the other one is bruising. Most of the time it's seen with the injections rather than the pen, but it can be caused with the pen as well. If used quite close to the eyes, it can drag on the skin. But again, when carrying out the PRP injections, bruising is a possibility, as with any injectable really. And then you have overworked. Now overworked skin is usually caused by doing the pen at the same section for too many times. So you have caused way too much injury to that one specific section of the skin. So it kind of looks like a bit of a scab, and as you will see, then it turns into a darker pigmented patch. But how to avoid this is just simply not overworking the same area for a prolonged time. PRP complications. Now here you have bacterial infection. Now this is strictly if the practitioner has not been sterile. If you haven't sterilized your equipment, your working area, your products, your needles, that is a potential complication, the bacterial infection. Also, if the client hasn't been careful after getting the PRP treatment, if they have touched their face with dirty hands or they haven't been sterile, again, that is a possibility that could arise. You also have temporary hyperpigmentation. Now this is caused by overworking the skin, as we mentioned. So that's if you've spent too much time with the Dermapen on the same spot, you've caused way too much injury. So when the skin actually starts to heal up, it would result in a darker patch like this. It's only temporary. It will go away in maybe about 2 to 3 weeks. The darker that the person is, the longer that it would take for the pigment to go away. However, it will go away, it's only temporary. And then you have the permanent hypigmentation. Now this is caused if you have carried out the microneedling and then the client has gone out in direct sun for a prolonged period of time, and hypigmentation can happen, and that could be quite permanent. So always make sure that your client is aware that they do need to wear sunblock for at least 7 to 10 days every day straight after the treatment. Contraindications, one of the main ones is cold sores, especially if you're carrying out microneedling as well as the injections. So cold sores are quite infectious, so they could potentially spread on the whole face after you have done the treatment. So anyone with a cold sore, they need to wait for it to completely heal, and then they can come back and redo and then do the treatment. Obviously, anyone with pregnancy, unfortunately, you can't touch them with any treatment. Anyone on Accutane, antibiotics, steroids, unfortunately, you cannot carry out the treatment on them, as all of these have a very compromising effect on the skin. They thin out the skin quite a lot, so they tend to be a contraindication to microneedling and injectables in general. Anyone with conjunctivitis, and conjunctivitis is very contagious, so they need to wait for it to completely clear, and then they can carry out the treatment. Anyone with cancer, just be careful when you're carrying out phlebotomy in case of operations due to cancer. If they're on radiotherapy, chemotherapy, you cannot carry out the treatment on them. If they finish the round, they need to wait for 6 months, and then you can do the treatment on them. Recent laser resurfacing or surgery, you need to see how long it has been, but you just need to give it about 6 weeks for the skin to completely heal, and then you can carry out the treatment. Anyone with diabetes, double check when the diagnosis was made, if they're on insulin, if the diabetes is controlled, and the doctor, has told them that they're perfectly fine and everything's in order, that it's not a problem at all. Obviously, anyone with blood disorders like hemophilia, HIV, definitely not. It's a blood-borne disease. And then hemophilia, that is when your blood is not able to clot correctly. So it can be a bit tricky trying to do microneedling and doing the injections as well. So double check with the client if it's severe or if it's only borderline. Anyone with a sunburn, they just need to wait for the sunburn to completely clear away, get their skin to heal up, and it's no problem. And then also anyone with any recent Botox and fillers in the last 2 weeks, unfortunately they cannot have any treatment if they've recently had the Botox and fillers. After 2 weeks have passed, they can have the treatment done after that. And then PRP aftercare, one of the main ones is no retinol, no tretinoin for 7 days. You just need to let the skin heal up really nicely. That takes about 7 to 10 days on average. No sunbathing, no sun tanning, and no fake tan for 7 days. As your client really needs to be aware to specifically stay away from sunbathing and sun tanning, as the sun can really damage the skin while it's still healing. There's no laser hair removal, waxing, threading, bleaching. Basically, just leave everything for about 7 days. And they also need to know that they need to wear a sunblock every single day for the next 7 to 10 days while their skin is healing, as it can be very vulnerable to the skin, and they can develop some pigmentation if they're not protecting themselves. Also, they need to know they cannot wear makeup for 24 hours. They don't need to exfoliate or scrub the area. Just 7 to 10 days. Just keep it hydrated. Use moisturizers. Use gentle cleansers, and just let the skin heal very nicely in the next 7-10 days. Now moving on to PRP for hair loss, and for here we're going to have a look at the hair growth cycle. So you have 3 main phases. You have the anagen, the catagen, and the telogen phase, and for each individual one, that is a different stage of the actual growth of the hair. So the anagen stage, this is the first initial one as to where you have the new healthy kind of hair, and then you have the catagen stage. So this is when the hair is actually preparing to fall out. And in the telogen phase, this is where the dead hair just falls out and then is being replaced by a new hair that's formed in through the anagen phase. So there's this endless cycle of hairs where they're being produced, then they fall out and are being replaced by new ones. Now, when it comes to where the hairs are located, so that is in the dermal layer, that's in between the epidermis and the subcutaneous layer. So in order to effectively target the hair follicles and really provide them with the best environment to thrive, then you need to actually deliver your plasma, in this case, in the dermal layers to where the papilla of the actual hair follicle is located. Now to look into factors that actually affect the growth of the hair. Now obviously you have things like stress. So stress can affect the hair growth cycle, and you can lose a little bit more hair. You could see your hair thinning out. So that is one indicator of that stress. You also have aging. So with aging, you might experience a receding hairline, you might experience a lot more loss of hair, thinning of the hair. So that is very common when it comes to aging. And also genetics. So sometimes genetically people can be predisposed to a lot more hair loss. And then you have nutritional deficiency. So most of the time these are essential vitamins, so that could be vitamin C, vitamin D, vitamin B12. So all of these have actually got to do with providing enough blood supply to actually encourage the growth of the hair itself. Also hormonal imbalance, so this has got to do with the amount of estrogen, testosterone. So the more testosterone someone is going to have, the more hair loss they're actually going to experience. And there's another thing, there's alopecia. So one thing about alopecia is, in order to actually carry out the PRP treatment and have it really effective, you need existing hair follicles. So it's only when you have an existing hair follicle is the only time when you can actually stimulate the activity within that hair. The problem with alopecia is that most of the time they do not have any hair follicles, and if that's the case, unfortunately, the PRP would just not give them the expected results. Now, how to actually target the hair loss? You can do both the microneedling and the injections. For the microneedling, you can use about 5 ml of the plasma, and you can carry out the microneedling on a 1.2 millimeter depth with a 12-pin needle. You can use the actual dermal pen to create injury to the skin as well, as the injury itself will bring the blood supply up, and the blood supply itself will actually nourish and stimulate the hair growth on its own. And then injections, you can again use a 5 ml plasma and inject all over the areas that you can see hair loss, thinning, balding, receding. Just target those specific areas and use a 4 mm needle and inject quite superficially. And also quite you have to be quite frank with your client. A one-off would probably, you might not see a lot of difference, so it's usually a session of 3 normally, and very essential that you do need to do it every 4 to 6 weeks, and this is to actually catch the hair in the correct phase of the hair growth in order to really stimulate the growth of the hairs. And then aftercare advice for PRP for hair loss. One of the main ones is that they cannot wash their hair for 24 hours. Now, the reason why they cannot do that is that you've delivered a lot of plasma to stimulate the hair follicles, and by washing their hair, they might actually end up washing off a lot of that really good plasma. So you do want it to be on the hair for as long as possible. They also cannot wear a hat for 24 hours, and they have to be quite careful with swimming for 7 days. So the actual chlorine in the swimming pool can really irritate the injection sites. Also dyeing, bleaching, doing anything to the hair, they need to avoid that for 7 days due to the injection points that you would have done. No heat treatment, and that would include, a really high heat, a blow dryer. especially in the first couple of days when the skin is still healing, can be quite painful for the client. So make sure that they're aware of that. And also no keratin, no chemical treatments, literally for 7 days. They cannot carry out anything that's quite harsh on their hair, as you know, it's still going through all of that healing. So make sure that your client is already aware of that before they even actually book the appointment with you. And that's everything that you need to know about carrying out PRP treatments on the face and on the hair, and I hope it helps.